little bit more about what she's going to be speaking about. Let's wait for that to happen. Good morning.
Good morning, darling Vicky. Good morning, everyone. Hope you all had a nice weekend.
How are you? How are you?
I'm good. I'm good. I'm really kind of buzzing. The sun shines here. You know, it's a good Monday. And we've got some fantastic things to talk about, don't
We
we?
have got some fantastic things to talk about. Now, you're giving your talk on the Friday at Aesthetic Medicine Live, aren't you, at 2 o'clock? And you're going to be talking about, now let me say this correctly, SkinXiety?
Yeah.
This is a term that you coined yourself, didn't you, during lockdown, relating to people's concerns about their skin and anxiety around their skin. So can you just tell me a little bit about that concept?
Of course. Vicky, what I'm going to do is I'm just going to take my little lovely puppy next to me. I'm going to say hello to her
Oh,
from
lovely.
everyone. But look, Vicky, guys, we've all seen what COVID has done to us, right? It's been an exhausting time, that side. But actually, when it comes to our skin, have we all felt a sense of anxiousness, feeling a little bit down, perhaps with a mask always over the face, you know, with the congestion, with the spots, for example, pigmentation on the rise, etc.?
Yeah.
Feel all of us have suffered to a certain extent in the last 2 years. I don't know, have you had any experiences yourself?
I have. Well, I can see now in this light that my pigmentation has definitely got worse.
Right.
I think the stress has aged me over the years, and I've suddenly got very blocked pores all over my forehead, which I've never had before. Loads of little spots and blocked pores, and I wonder whether is that because of the mask wearing?
Absolutely, you know. And the other thing that I've noticed, and you know, I'm a peeler. I mean, guys, you know me.
Yes, you are a peeler.
Right. But actually what I've realized, and this is why I want to talk about the Linton's Illumi facial today, peels go so far. And when it comes to pores, yes, they do the job. When it comes to yes, it can help. Texture, wrinkles, yes. But you know what, Vicky? The one thing that I'm really worried, and I'm wearing red for a reason today, is redness. You know, and we have somewhat forgotten that mask knee as a has resulted in the increase of redness. So not only congestion, not only do we get dilated pores, not only do we have the spots called mask knee, right? But we also have this redness. And unfortunately, peels have a limit. They can't do that. And that's why today I'm talking about the Illumi facial, because I discovered something for myself during the COVID period, which I think is going to help a lot of our practitioners. So hence I really wanted to talk to you about this, because today it's not just about pigmentation and spots and wrinkles, but we have to also embrace redness. And I don't just talk about rosacea per se. I think we've all a sense of redness, particularly when wearing the mask in this zone, when the skin heats up, you get that flushing, etc. And it is very kind of traumatic, you know. I get quite a lot of redness myself through here, and I have to up, you know, because I feel like it's not the right tone that I want to.
That's so true, isn't it? And I wondered why that had occurred. I was on a Zoom call the other day, and I noticed my face was really red, and I thought, why's my face so red? And obviously the camera, different lighting and stuff like that, but we're all very much more aware of our faces, aren't we, since we've been doing a lot of these video-based interactions. Have you noticed that people are more aware of their skin because of they're looking at themselves? Because you can't help but look at yourself even when you're on these things.
Well, exactly. You know, we live in a world where self-perception is becoming much more important.
Yes.
And, you know, I talk about skin clarity being the universal beauty metric. And people assume skin clarity just means, you know, pigment-free skin or spot-free skin. But actually, COVID has made us really focus on redness. So anyways, I really wanted to talk about.
Yes, how are you treating your patients at your clinic with these problems?
My patients' experiences, particularly now, you know, we say we're coming out of COVID, but actually the reality is we probably have ins and outs. So masks will in our lifetime, whether we like it or not.
Sadly. Yes.
So I'm actually quite pleased that Linton have come up with a very interesting concept. And I'll tell you why I think it's interesting, if it's okay.
Of course, yes.
Vicky, in our world, you know, of skin, we are usually based on monotherapy. So, for example, practitioners tend to go for peels or for lasers, right? Or for skincare, and we see them as unidirectional treatments, right? So we think if you go for one, it's going to do the job for you. You might need a few sessions, and that's that. Now, what we're discovering in the B2B world is mixing. Multimodal is absolutely everything now.
Yes.
But the question is, how do you do multimodal and not get any problems?
Yes.
Right?
Yeah.
So when I wrote this book in 2014 with my friends about the
the giant book.
When we wrote this book, the last chapter was, you know, how do we mix and match? And unfortunately, I think still a lot of practitioners, and I'd love to hear what people have to say, are still nervous. They're still nervous matching.
Yeah.
Now, the beauty with this Illumi facial from Linton is that you mix the world of peeling, which I love.
Yes, you're a big peel fan, aren't you?
The world of energy, laser. So in this IPL, so you've got your peel and you've got your IPL, and you bring it together and you get synergy. Now, Vicky, when we say synergy, what happens is in this Illumi facial, you use two products. You use peels.
Yes.
4 peels in one, which is even better because, you know, each peel has a different effect. So you have your glycolic as the mainstay, 20%, there's a bit of mandelic, there's a bit of salicylic, and then you open the surface of the skin, and then you let the IPL 585650 go deeper. So what do we get? And this is what people always ask me. And you get this. Look, you get improvement in acne and spots. You get improvement in collagen, so wrinkle reduction. You get skin tightening. You get skin tone. Now, skin tone for me is not just pigmentation. This is about redness. This is the biggest. Softness and smoothness, and of course your hydration, because you are now resurfacing. You're getting that skin nice and juicy, glowing and radiant, which everyone adores.
Of course.
So go on.
I was going to say, of course, that's what we all want, isn't it? We all want a nice glowing radiant skin. Yeah.
And you know, Vicky, people always ask me, well, is Illumi facial for everyone? And the answer is yes. You can taper the duration of the peel. You can taper the energy of the IPL. But ultimately, in 6 sessions, so you just need 6 sessions, you're going to get a skin turnaround. So you can work on all of those aging parameters, all genders. You've got your ethnic skin types. Of course, you've got to be more careful with the darker skin. That's the peels anyways, and any form of energy-based device. But for me, this is such an all-rounder, Vicky, and it's really opened up my eyes to how easy and quick it is to achieve this, particularly in the COVID world. I think COVID, because we're not quite post-COVID yet, but I think
we're not really, are we? We hope we are, but we're not really.
No.
And how many treatments would someone need to see results with this?
Yeah, good question. So look, what I say typically is this: we need at least 6 treatments, and I would stage them around 4 weeks apart. That is the beauty of it all. So 4 weeks apart gives you that beautiful turnaround. And I say, look, at least once a year, we all deserve to have good skin. Let's be honest. Brave this. This is why clarity of skin is a universal beauty metric. See clear skin. Humans release neurotransmitters, dopamine, epinephrine, etc., and they make us feel good. Those are the kind of, you know, the universal things that we all want: clarity of skin, symmetry, proportion. In women is the high cheekbones. In men is that square jawline, that sharpness through there. So really, you know, this is an all-rounder for absolutely everyone.
Fantastic. And what about in terms of downtime and things like that?
Minimum. Look, the peel is 20% pH of 3, you know, minimal downtime. The IPL, yes, it has a little bit of a zingy sensation, you know, get a little bit of redness, a little bit of a pinching sensation, but honestly, it's nothing. It's nothing women go through, right, every month when we have to do other beautifying procedures. So for me, this is a kind of a no-brainer. And what I love to do, Vicky, is after the treatment, it's actually a 4-stage treatment. So you cleanse, I'll show you. You do a cleansing procedure first, then you peel, then you do your IPL to treat the redness and the pigment, and then you have the Linton pre-made skincare for you. So there's a variety of stem cell products. They've created a beautiful post-treatment cream and lock. So your patients go home with these products on their face, and it just soothes and it hydrates the skin. So you might get a bit of redness, and I say, look, the pigmentation is going to rise to the surface, and that's a good thing.
Yes.
That we have, and I have a lot of myself, will rise to the surface. It'll be obvious.
Yes.
But you feel good because you're seeing the change, and you're feeling like, oh my gosh, at last.
Yes, doing something.
You know? So as long as the patient knows that, within a few days, it's absolutely fine. Makeup right after is absolutely fine. So patients don't really notice a huge downtime at all.
Wonderful. Now, people can hear you talking more about this, can't they, at Aesthetic Medicine Live? I'm just interested as well to know, you know, like, obviously there's so much out there, isn't there, in terms of treatments and devices and things like that. When you're making a decision like this to bring something new into your clinic, what's your sort of thought process around that? How do you decide to, right, I'm going to bring this, I'm going to go with this?
Good question.
It's a big decision.
It's been a question that all of us have been trying to ask ourselves.
Yes.
We've had a difficult time, and I speak for the global community. You know, I do a lot of lecturing around the world, and I always ask my friends, you know, what's going on? How are you feeling about aesthetic medicine? We've all had a difficult time. Clinic lockdown, shutdown, patient kind of moving around. And what I've noticed my friends say is people want innovation. And you've got to target what matters, hence coining the word SkinXiety. It's not a flippant term. It really is quite a serious issue, you know, that people feel. It's not about, you know, I want bigger lips, I want fuller cheeks, you know, it's more about confidence. It's more about how we perceive ourselves in society. And we have to value that. That to me is the definition of health, that well-being. And so for me, I noticed my friends talk about that. We talked about redness on the rise with masks, you know, and how do you control redness? It's not just rosacea anymore. It's everyone suffering from it. And redness makes one feel like they're not, I don't know, perhaps they're stressed, you know, that life's not going so well. So redness has a huge psychological anxiety point. So for me, it was kind of like, how do I get this? Marry the world of peeling that I know so well. And how do I marry up the redness, which peels can't do?
Yeah.
So I just identified an area in my patient group, deliver, and then I targeted the whole population span. You know, so look, it's every age group, every gender, and most skin types. You know, so this is kind of like it ticks so many boxes for me, and a lot of practitioners have had the same process, and I really encourage everyone to have a look at this, try it out. You know. I'm a practical person. Hearing is one thing, but doing a treatment is, and I know Linton are very up for kind of showing you kind of running through step by step of how it feels. I really encourage practitioners to have a go, see what you think. But yeah, for me, it's an easy no-brainer, really. It's that kind of airbrushed look that, you know, everyone's talking about in Zoom face. How do you airbrush without having to click all the functions?
All the filters that they have on, and then you can tell when people have got filters on because their face looks warped, so it doesn't really look real, does it?
Airbrushed, flawless, luminous skin. That's what we're trying to talk about here.
Lovely. Now people can come along and see you speaking as part of our demo stage program, and that's on Friday the 20th of May at 2 o'clock. Your talk is, isn't it? So please do come along and hear Uliana speak very passionately more about this topic and about this time SkinXiety as well, and the treatment. And yeah, do come along and join us. You can go to aestheticmed.co.uk/register, which is always a mouthful, to register for your free tickets to the event. Please do come along and join us. I'm looking forward to seeing you in person, Uliana.
Oh, I know. I'm going to hug you properly.
It's been a really long time and I can't wait.
Brilliant. Well, look, if there's any questions, by all means, you know, I'm here. Get in touch and we'll see you at Aesthetic Medicine Live. I'm looking forward to it. See you soon, everyone.
Thanks so much for your time. Take care.
Bye.
Monday. My name is Vicky Aldridge. I'm the